Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. Welcome to Community Matters. Today I am joined by Bobbette Shofner, the Executive Director at Mount Carmel Clinic in Winnipeg, Manitoba. Founded in 1926, Mount Carmel Clinic is Canada's first community health centre and is celebrating 100 remarkable years of service this year. We are thrilled to mark this milestone, learn more about the incredible work that they do, the impact that they've had, and how they continue to meet the evolving needs of the people they serve. And of course, we are excited to hear about the celebrations that are planned to honor a century of care and community impact. Bobbette, how are you?
Hi, good morning. I'm good, thanks. How are you?
Good. Yes, thank you. An early morning podcast, but I'm so energized because 100 years of CHCs, a complete milestone, so exciting. I've only really even known about the movement for the 5 years I've been with the company, so thinking of 100 years of CHC work feels like a concept I can't really grasp, but I'm so excited we're going to have this conversation. As I was saying before, I'm so excited also to finally have Mount Carmel Clinic on the podcast. So if anyone's listening who's not heard of your community health center before, I'd love it if you could just talk about a bit about your CHC, the clients you serve, the programs that you offer in Winnipeg.
Well, thank you very much. Very excited to be here. And yes, we're turning 100 this year. And so that's very exciting for us. It's been a long time coming, but I always say we look good for our age. So we're very excited about our 100-year celebrations, but that really is focused on our community. And so 100 years of serving community is really a privilege for us. And the fact that community still comes in our door and trusts us with their stories and their journey. And that's really what this is about. And so we serve a broad spectrum of folks in the north end of Winnipeg. We really serve and have served for a whole of the 100 years from that holistic perspective. And so we have 3 primary areas at Mount Carmel Clinic: primary care, early learning, and community services. And so we have sort of that typical healthcare when people think of it. We have doctors, nurses, nurse practitioners. We have a pharmacy, lab, x-ray, dental program. So we have the lowest cost dental program in the city. We have a pharmacy that has prescriptions on credit, so folks don't have to choose between food and medicine. We have the only not-for-profit chiropractic program in the city. We have midwives, we have lab, x-ray, EKG. So we try to have a full service one-stop shop there in order for folks to be able to come in and do all the things that they need. From our early learning direction, we have the Ann Ross Day Nursery, which is infants up until 6 years old. So we have our kids running around here, community kids, staff kids. My son got to grow up here with lots of kids in the community. And so it was very exciting to have. That's the best part of us, I always like to say. And then we also have a parent-student support program. And then Manatu Ikwe Kagi Ikwe, which is a program that works with women who are pregnant or early parenting, involved with substances, or at risk of having their children taken away. So we do a variety of things there. In our community services direction, we have Wizo Katatuin, which is our assertive community treatment program, working with folks who are houseless and dealing with mental health struggles. Sage House, which is our program for female identifying folks who are involved in the sex trade or exploitation. We have Thunderwing, which is a program that works with families and supporting them in reaching their goals. We have our Indigenous wellness programming. We have a multicultural wellness programming. This would be a very long time. So that's sort of a bit of us. There's much more to talk about in there, but we are a variety of programs that have been sort of pulled together because community tells us what they need, and we try to follow that path of asking community what they need, and then following that path of putting things in place. So
amazing. I would imagine in 100 years you built quite a few programs, so I appreciate the snapshot. But take us back to the beginning. So I would love to hear why Mount Carmel Clinic was founded, 100 years ago.
So 1926, there was a variety of folks that were moving into the community, and particularly Jewish folks who were coming here who didn't have access to programs and services. And so there was also Jewish doctors and dentists that came to serve. And so the original house on Pritchard Avenue was a redecorated home where providers would come and serve for free and serve folks who needed services in the community. And that was about a 3-year run that quickly got outgrown. In 1929, they moved to a bigger location. And then in the 80s, we moved to the campus here, what we call our campus, in terms of the growth of Mount Carmel Clinic over the years. And so we really started serving from that just sort of small place of a few people every day that were coming for the needs that they had. And about in the 40s, they hired the first employee, and today we serve hundreds and hundreds of people every day. And so it's been a long journey of serving folks really in the geographical area for the most part of the north end of Winnipeg, but beyond that as well. So we have a lot of folks that come and go from the north or come and go from other areas. And so we've grown steadily and we're still growing. And that is in connection to community that asks us to do more. And we have lots of community partners. And sometimes it's our job to take on a program, and sometimes it's our job to help another organization take on a program. But yeah, it's been a steady growth of really trying to serve the folks who ask us for what they need and then trying to serve that need.
Of course. And I'm curious, obviously, with that wraparound care, meeting their needs mindset, how has the mission evolved and then remained, constant?
Yeah. So it really, the words change. I can look back and see different mission, vision, values, and we like to call ourselves unique because we have a smattering of programs, and we've always tried to be innovative. And so that innovation is partly because folks ask us for what they need, and we try to do that, but also because we serve some of the most marginalized people in the city, and you have to be innovative because our folks face barriers consistently across systems and programs. And so, that innovation has really helped us bring on a variety of things. And so I would say that we've really changed, but we've stayed the same. And so that beginning perspective of working with folks, satisfying what they need or providing services for what they need, looking from that holistic perspective, that's what we really try to stay true to. Like 100 years later, that's really where we're focused, right? Serving the whole individual, having them trust us with their journey and coming in our doors means a lot to us. And so making sure that we're asking them what they need and trying to point them in the direction, whether it's us or a warm handoff to a partner, it's serving that holistic perspective for an individual.
Amazing. And through the 100 years, can you share some important milestones that have happened? I'd assume you haven't been there for all of them, but if you happen to, no. But if you can share some of those milestones over the last century.
Yeah, absolutely. So I've been at Mount Carmel for about 18 years now. And so looking back over the 100 years, we've had a lot of growth, particularly both from a physical space perspective, but also from a serving perspective. So, started out in the 1920s and grew very quickly to several different buildings. In the 20s, we had 2 different locations. And in the 80s, we managed to locate this empty site and then built from scratch in the 80s. And so, those are a couple of big milestones in our history. But really, started out serving the Jewish population in the north end of Winnipeg. And in the 40s and 50s, that really changed. There were more people coming in. The Great Depression in the 30s really changed, the way that people were moving around. And then we also saw, particularly in the 50s, our First Nations and Métis relatives coming into the community. And so as we've moved along, the populations around us have changed. In the 50s, 60s more so, and newcomers started moving into the community as well. But I would say the constant really has been serving some of the most marginalized folks across the city. And so in 1940, the early 1940s, Anne Ross was the very first employee of Mount Carmel Clinic. And so we have the Anne Ross Day Nursery that's named in her honor. She became the executive director in the 60s and so was here for quite some time. But really, I think what she helped with was that push for advocacy across all the populations that we serve, and that push to have government understand our community more and provide the resources that were needed in the community.
Amazing. The next question, I feel like you sort of answered, but if you wanted to elaborate on any of those specific services that have evolved to meet that like changing population catchment area over the 100 years. And I mean, and the question after is around like innovation as well. So as you know, that 100 years we've seen tech change, phones change, so many approaches change. So if you wanted to answer maybe a 2-for-1 around service change and innovation change.
Yeah, so I think that clearly from over 100 years, technology change has been at the center of a lot of what we've been doing. And so as a not-for-profit, that's not always easy to satisfy. We're not always at the front of the list in terms of being able to buy or engage in some of the best tech, but we've been very fortunate. One of the things that happened, I think it was in the late 80s, early 90s, the Mount Carmel Clinic Foundation opened up. And so we've been able to have a lot of really great support from our foundation in being able to stay current and stay innovative. Um, I would say that, some of the things that have happened over the years in terms of starting in that small house and starting out small, I'd say, the continuous need for our community has always come along, and then the organization has always been able to answer that in the best way that they've been able to. And so, we started out as that typical primary care clinic in terms of doctors and dentists and those kinds of services, but moving along into the early learning years and moving along into serving women and their children and moving along into serving folks with distinct mental health struggles and those who are involved with substances. So there's been a progression of growth and services. We've also, from that innovative lens, I would say we try to ensure and have been at the forefront of really some of the aspects. Many years before I started, the clinic operated from a primary care perspective of having innovation of teams. So teams including doctors, nurses, nurse practitioners, dietitians, social workers, the medical office assistants and medical clerks. And we've always worked from that lens. And so we've always been able to have the right care from the right person at the right time as much as possible. And our folks are coming up to us with a variety of needs. And so not a lot of our folks are coming for the every 1 or 2 year doctor appointment and off they go, right? We have folks who are facing homelessness, food insecurity, a whole variety of social determinants of health struggles. And so that can be a big part of how we've evolved. Part of that is not just us coming up with ideas, but other folks coming up with ideas. So the Manitoba Chiropractic Association reached out to us 15 years ago, and that's how we engaged and have the chiropractic program that we have that serves folks who otherwise wouldn't be able to engage in that service. As an employee here, I have benefits that allow me to be able to engage in that, but our folks can't afford to do things like physiotherapy, chiropractic services, and things like that. And so it's been a great service for the last about 15 years or so. Our dental program, we continuously and have always maintained the lowest cost dental program in the city. The Canada Dental Benefit Program will change some of that. So we're very excited, not just because it'll change a little bit for us, but mostly this is a community that doesn't heavily engage in dental program services because one, you have to pay for it. And two, when you're just trying to feed your kids and keep a roof over your head, sometimes dental isn't at the top of the list. So we're very excited. We're trying to educate as much as possible. We don't care where you go, as long as you know that you have this new service. So things like that have really been a central part of how we've tried to operate at Mount Carmel Clinic. And we still continue to try to ask our community, what do you need? How can we serve you better and go down that path?
Amazing. And in terms of navigating challenges, we all know community health centers unfortunately have their challenges, whether it's funding, policy, or workforce, which I think was really highlighted during COVID, that level of burnout with being like a frontline team and staff. So how has that been navigated over the century and the 100 years?
Yeah. So, I think it's come at us in a variety of ways. And I think, those of us in the not-for-profit sector, particularly in community health, none of this will be a surprise to anybody. But of course, money tends to be like the biggest issue, right? I'd say that comes in two realms. Our community feels comfortable coming here. We want to provide services here, but we can provide within the funding that we have. So as the largest community health agency in the city, we're open pretty much Monday to Friday, 9 to 5. Closed most evenings, closed on the weekend. That's not when Monday to Friday, 9 to 5 is when some of our folks need us, but many of our folks need us outside of those hours. And so that's an integral part of us constantly trying to figure out how we can expand and grow into that time. So funding for that would be fabulous if we could grow into that time, because we also have lab, x-ray, pharmacy, EKG, docs and nurses, right? So we have a variety of things. We are able to do some programming, like group programming and things like that. We have drumming circles, we have newcomer groups, we have things like that we can put on in evenings and outside, but that is piecemeal. It's not our clinic open those hours when folks need us the most. And so, that's a big part of the challenge. We're not funded at the same level, as other community agencies, but the bigger health system in Winnipeg. And so we tend to bring our folks in. We're unionized for most of our folks, but of our outer scope folks, we're not funded at the same level. So you can come in here, get some experience, and then you can be pulled into the bigger healthcare system for a higher salary. And so that continues to be a struggle for us. I'd say before COVID, we were pretty steady, like most folks. And then after COVID, the turnaround rate has seemed to expand. I think there's just, it feels just overall in healthcare, it just feels like there's not enough people to satisfy the need. And I would say also since COVID, we work with a community that often struggles. There's many great gifts, and every person we serve has a great deal of gifts. But there's also a lot of struggles and barriers that our folks encounter. And I'd say also since COVID, that has changed exponentially for our community. And so there is a much greater need for the programs and services that we provide. There are more folks asking us to do more with them. And we don't have anything extra to do it with at this point. And so it's hard to see community struggling because that means they need more from us. And as we're trying to do more, as the whole healthcare system is trying to do more, and I understand that as well, but we'd like to do more for our folks here. And so that's a continuous search, a continuous conversation, a continuous asking for, hey, this is what the need is, or this is what our folks need. And so that's an ongoing struggle.
Yeah, I completely hear it in a lot of other podcasts and completely understand why that would be an ongoing issue. But I am also curious, despite everything that you just said, any words of advice or encouragement for some of the emerging CHCs? We seem to have a plethora of emerging CHCs popping out of British Columbia that are part of our membership, or anyone who's just getting towards that 100 years. Those like words of encouragement for continuing to do this amazing work.
Yeah. So, I'm not going to lie, I'm a little biased, but I feel like CHC is the way to go, right? And so, I would like us to see this model, and I've been able to work here for a long time. I have great partnerships and grateful to have partnerships with other CHCs in Manitoba, but have looked at, a few across the country. We do phenomenal work, if I can say that. There is a great way of working in community health that I think is different than most of the other ways that are worked in the rest of the healthcare system. And that's not a knock on anyone. I think there's ways that we can be adaptable and mobile and shift and to meet our community's needs in a way that a bigger system can't. And so for me, community health centers, the community health center model is something that I'd like to see grow and expand. And so just looking across the country and looking across our province here and, in terms of advice to folks, I'd say keep up the fight. The more that we can expand this model and models related to this, I think the better off our populations that we serve are going to be, and the better off that our province and our whole country is going to be. I think that this is an upfront care. We try to do preventative care. I think that's the way that we need to go in the healthcare system. And so I just encourage folks to continue on and keep going with the fight. And I think growth is critically important in our sector.
Amazing. And now that we've talked about all the logistics of the 100 years of Carmel Clinic, let's talk about the party.
Yeah.
I would like to book my flight out. Don't
There's
tell,
a few
tell
things,
us.
a few
Pardon?
things you can come to. There's a few things you can come to.
Yes, that's what I would like to hear. So please, what are the exciting plans that you're hosting and what you have in store this year to celebrate Mount Carmel Clinic?
Yeah, so we're very excited for this year. It's so exciting to reach 100 years. It's a huge milestone, right? And so for us, it's really all about community and making sure that community is aware that we're here because they allow us to be here and that they grace us with their gifts and their stories and their journey. And so we have a few things going on this year. And so we're slowly marching our way forward, putting out our letters and our information to folks. And then we have some events coming up. And that's really where we're going to be able to gather together. So in May, we're hoping to have an alumni event for all the folks that are connected to Mount Carmel, have come here, have worked here, have anything to do with us. We're hoping to have folks in the door because we look a little bit different and we've changed over the years, and we want folks to be able to come and revisit us. And I hear a lot of great stories with people who are connected to Mount Carmel everywhere that I go. And so we want to be able to invite them back in. At some point this year, we're going to have a donors event as well. And so we're looking for folks to be able to learn more about us and look for that engagement with our donors and our funders. And one, say thank you, and two, see if there's anything that they can do to help us move this movement forward as well. And so that's coming along. Every year, we have a very big celebration for National Indigenous Peoples Day. And so that's a very fixed time of year. And this year we want to, with the guidance of our elders and our knowledge keepers, expand on that and have a big community celebration with our 100th anniversary as well. And so that's going to be, that's the best event, really. Every year we're able to, open the doors, close the services, and just mix and mingle and eat together and have fun together and dance together and sing together. So that's really going to be one of our really great events. And then towards the fall, we're going to have a staff event and really thank our staff in a good way. And that event is still coming along. And I'm not going to say too much about that because my staff keep asking me. And I want it to be a bit of a surprise. But we really want to say thank you to our staff because our folks could be going anywhere else and getting the same paycheck or more, or working with community in other ways, but they choose to come here. And that means a lot to us. And we ask a lot from them and they give it day after day. And so we want to celebrate our staff as well. And so, but really community does that on a regular basis. And so we're excited for this year. We're excited for a few other things that are coming along that we're still working on with some launches and some other things. And so it's a full year of fun and excitement.
Well, I think I heard a couple places where I can come visit, so I may pop by. But no, sounds really, really exciting. And I imagine that so much effort probably has gone into celebrating this 100 years with all of these different events. So congratulations on, event management on top of your job, because I'm sure that this was just added hours to try to celebrate. So I will congratulate you for that extra effort. What are the goals for the next 100 years of Mount Carmel Clinic? You again won't see all of that 100 years either, but I am curious what you hope for, what the whole organization hopes for in the future.
Yeah. So let me say this. Let me say, so our 100-year celebration is coming together with one of the most fabulous teams that I could ever work with. And so I certainly don't do it by myself. We have a team here that is absolutely phenomenal. And so they not only are helping us look back, but looking forward. And so looking forward really for me means that we're still listening to community, that we're growing in the way that they need us to grow, that we're fighting for that equity and that advocacy around removing barriers for our community, around growing programs, if that's what they're asking us to do. I don't like to sit here and say this is what we should be doing, because it's really not up to me. It's really up to all the communities that we serve, and we serve a wide breadth of communities, primarily Indigenous folks in our community, newcomers to us, LGBTQ folks. So there's lots and lots of folks that we need to make sure that we're asking questions to about the directions they want us to go. But I really do hope and want to continue on the path of the community health center model, really. And that's about integrating with a variety of people and meeting people where they're at and providing that non-judgmental care. I think those are the most important things about what we do, welcoming people in to tell us about their journey and ask them what their gifts are and ask them if we can walk with them on that journey. I think that's the most important part about how we're going to move forward. And so I can't tell you exactly what we're going to do in the next 100 years, but I think as long as we're asking community about what that next 100 years looks like, that's the most important thing.
Clearly the values and the mission you already have is a really great start to the next 100 years. So you're definitely already on the right path for sure. Why does the community health center model matter now more than ever? And I think you could hear tidbits of it throughout our entire conversation, but in case somebody is like half sold on this model at this point, closing that deal, why do you think community health centers are the way to go?
Yeah, that's a great question. So I think the world knows how stressed and tapped the healthcare system is. I don't think that's a secret, or, it's different in any one corner of the world. And everyone's trying to reach for innovation. Everyone's trying to figure out how to do more with less. Everyone's trying to figure out how to continuously improve care and services. And I would say that is what community health centers are all about. Continuing to serve more, continuing to get it right and get it done better, continuing to integrate with our community and ask community questions about what they need, continuing to take not just this program and this service, but looking across how we can bring them together to serve the person better versus making sure the person gets to all the different places they need to go. That's really about how we operate. And so that value base of community health centers, I think, really is a model that could be lifted and put onto any type of healthcare, right? Looking through that equity lens, to be able to make sure that we're serving all folks in the best way possible for the needs that they have. And so community health centers, I think I said this earlier, I really believe it's the way that we should be looking through that lens to be able to create health services going forward. And it would be a great way for not only just community health centers, bigger regional health areas, governments. I think everyone should be looking in this direction. Again, I'm biased, but I think it really is a model that works. And so, we have folks here that come in, folks on our wait list, myself, in terms of the healthcare that I need or my son needs and family needs. I think if this movement could grow, I think folks would be served best in this kind of a healthcare setting.
100%. Also guilty as charged of going to a community health center. Once I learned about them, I was like, oh, you have a therapy program I need. Let me sign up. And it was so easy, simple, wraparound care. And then I was able to talk about the services at my job. So it worked out very well.
Yeah, that's great.
Right. Yeah. I love this question. I talked to you a little bit about it before we started the podcast, and you did mention a little bit what you would do with increased funding. So if you could get that funding, whether it's federal, provincial, or municipal, what would it allow Mount Carmel Clinic to do or achieve?
Yeah. So I think, just that's always a question that I'm always talking about more money, scheming about what more money would mean, asking folks what they need and looking for more money. And so that's a constant in my job and the job that we do here. And so I'd say two main areas. I think space is always a factor for us. And so on the smaller level of it, we're always looking to grow more because we're always pushing out our corners. Every space, we're doing a space shuffle. And so we know that we need to grow. We know that we need to innovate our spaces. We know we need to keep them up every year. And so that capital means a lot to us. And being able to expand means we can provide more services to folks in our community and around our community. But more than anything, expanding into our evening and weekends, expanding programs and services. And so I can't look in any one direction and just say this program needs and that program needs. I think there is a constant need across all of our programs in our community. And so we're constantly looking to grow and expand. I'd say for the most part, it's the hours piece. If we could just do what we do on a longer basis, that would help so many more people. Our moms wouldn't have to leave work to be able to come, we wouldn't have to take kids out of school to be able to come here. And a lot of our folks, especially the folks that we work with who are the working poor or just sort of skating by and can't leave work, right? That would just mean something so different for them. And so we try to do that as much as we can. In terms of our dental program, we have the only, I believe, not-for-profit program that's open in the evening. So our dental does have 2 evenings that it's open, but that's it, right? So we have a teen clinic in the evening and then we're 9 to 5. And so, I think that would mean the most to our community because they have continuously asked us for that change. And then expansion on some of our programs and services, particularly our Indigenous programs and services. Our community has continuously asked us to indigenize and serve them better. And so serving our relatives is important to us in a way that they would like us to serve them. And so that also is another critical area that we'd like to expand on.
Amazing. Thank you.
I could go on with that one forever. So
my goal is to someday take the answers from this will be episode 55. So I've asked that question 55 times and just string them all together and then email them to the right people and be like, here's everything everyone's asking for. Like Santa Claus, here's the list, please provide. But that's not how it works. I wish it was.
Yeah.
But everyone could. Yeah, go on.
Yep.
Last question, and I think it's a fun one. In one sentence, what is Mount Carmel Clinic's legacy?
Yeah, so this one's really hard. Trying to figure out how do you package 100 years in one sentence. That is really something that I've been sort of thinking about and trying to figure out how to say Mount Carmel in one sentence. So clearly I'm not doing a good job already. And so I would say that I think community is the heart of what we do. And so I think what I can say about Mount Carmel Clinic is that listening to community, following community, respecting community, walking with community, I think that's the heart of what we do. And so continuing that, looking back on the 100 years and seeing how we've brought that forward and continuing that, I think is the most important part.
Amazing. We'll call that one sentence.
That's way more than one sentence, I realized.
Commas, semicolons, a couple hyphens, an M dash. Make it work. No one's typing.
That's how we make the money work. We just spread it out, right?
So. Yeah, exactly. The community health center approach to a sentence. I love it. Thank you so much, Bobbette, for this amazing conversation, and congrats again on behalf of everybody at Catch for your 100-year-long legacy. If anyone listening wanted to learn more about anything that you mentioned or any of the events and they want to go and head out, where could they find more about Mount Carmel Clinic?
Of course, mountcarmel.ca. That's our website. Go to the website, you'll find more about us, but then also reach out if all our contact information is on the website. And so you can reach out to us if you want to know more, if you have any questions. And more will be coming on the website as we launch new things and as we, march through the year and different celebrations. But that's where you can find out about us. But I always say we're better live and in person. And so reach out to us or email me if you have any questions too.
Amazing. Awesome. Thanks so much again for chatting with us, and congrats again, Bobbette.
Thank you. Thank you so much. 100 years is a great celebration, and I appreciate this opportunity.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.